Patients with Waldenström's have a limited number of treatment options. We know that this is, in general, an indolent lymphoma that responds to different drugs, but definitely there are limited treatment options. So unfortunately, we don't have a lot of trials dedicated specifically to patients with Waldenström. So a lot of the treatment practice has really been extrapolated from what we've learned for follicular lymphoma. And right now in my own practice, treatment has been largely similar to what we do for follicular lymphoma, where patients get treated up front with chemotherapy combined with rituximab, and at relapse tend to reuse agents from the past. The trial that was presented is going to be a very important study in terms of guiding practice. So this was a randomized comparison of Ibrutinib combined with Rituximab versus Rituximab and placebo for patients with Waldenström's who were either previously untreated or were known to be Rituximab sensitive but previously treated. What the trial showed us was that the combination with the Ibrutinib and Rituximab led to a markedly improved response rate, as well as progression-free survival for all of the patients enrolled in the study, regardless of what their prior treatment status was. The overall safety was as expected for both of the drugs alone. There were no new safety signals highlighted, and was fairly typical for what's already been reported with Ibrutinib alone and Rituximab alone. I think one of the interesting things that came out is that because patients receiving the combination had such a rapid improvement in their disease, there actually was evidence of a decrease in terms of an IgM flare if it was given in the combination. Also, an improvement in anemia was seen with the combination, and also a decrease in the rituximab infusion-related reactions was seen. So there are certain aspects where the toxicity was actually improved with the combination. At this point in time, it is an indolent disease, and there was no difference in overall survival statistically between the two arms. So I think we know that patients receiving the combination had a much better control of their disease, but at this point it's too early to comment on a survival advantage. I think it's strong proof that the combination of Ibrutinib and Rituximab is very effective treatment for Waldenström's patients. Right now, the comparator in the study was Rituximab alone, which is, I do use Rituximab alone in my patients with Waldenström's from time to time, but it's certainly not the upfront standard of care. So I think it remains to be seen where this might fit in. I think it'll be a very important treatment option that we all want to have available for our patients, but where it fits in terms of the management scheme, I think still remains to be determined. In my own practice, chemoimmunotherapy is still the upfront standard, so it would be really nice to see a head-to-head comparison of this combination versus routine bendamustine or rituximab, for example. I think either way it's going to be a nice, important option to have available, but it certainly would be nice to compare it head-to-head in the upfront setting against standard immunochemotherapy.